Hello, my name is Tao Griffith. I am an assistant professor at Loyola University Chicago Masella Nihon School of Nursing. I am also serving as one of the co-faculty leads for the organization named COVID Equity Response Collaborative Loyola, which is also known as CIRCLE. CIRCLE was established in March of 2020 in response to COVID-19 pandemic. Together, we have built a multidisciplinary network of academic, community, public, and institutional partners to advocate for health justice and health equity in local communities. We proudly serve the suburban Cook County, including the 5 hardest hit communities by COVID-19: Maywood, Melrose Park, Berwyn, Cicero, and Bellwood. These 5 communities are distinctly communities of color and share features that might lend themselves to higher infection rates, including low median incomes and very high proportion of cost-burdened households, many individuals employed in essential jobs, high dependence of public transportation, and crowded living conditions. African American and Hispanic residents in these communities have up to 3.5 times higher infection rates of COVID-19 compared to their white counterparts. And why these communities carrying the highest burden of COVID-19, they also have limited access to affordable healthcare and testing. The purpose of this research study is to leverage the infrastructure the Circle have built to accomplish the aims that are listed in the purpose section of the poster. We currently have 3 testing sites in Maywood, Berwyn, and Bellwood. The research project is still ongoing. As of February 22nd of this year, Circle has provided testing for over 500 residents. The majority of residents are African American and Hispanic. The positivity rate for our residents is about 21%. Please take a look at the first graph. You can see that the positive rates for our clinic days can range up to 47%, while Cook County rates is ranging from 4.7 to 14.7% during the same days or period. Please take a look at the second graph. So the social and legal needs graph, you can see that 3% report have legal needs, 26% reported struggle to pay rent or food, 30% reported lost income due to COVID-19, 21% have no health insurance, and 24% have no primary health care provider. These data related to the positivity rates and the social and legal needs confirm the significant burden and health inequities in these communities, which have been exacerbated by the current pandemic. We have also been collecting information regarding COVID-19 acceptance rates, and we have collected this information in about 102 participants so far. The data show that up to 8% might not plan to get the vaccine. And of those who are not planning to get the vaccine or on the fence, the reason include they don't believe that the vaccine will work, they have fear of getting sick from the vaccine, or thinking that the vaccine is unsafe, or they think that they can rely on the herd immunity concept, so they don't have to get it if others are getting it. In conclusion, the residents of colors in suburban Cook County have high positive test rates and are greatly impacted by the loss of income due to COVID-19. They are struggling to meet basic needs such as food, rent, and affordable health care. COVID-19 hesitancy is also evident in these communities. And after a year into the pandemic, the support and resources for these communities remain severely lacking. Therefore, a plan to significantly increase support, resources, and affordable health care to these communities is a public health priority. That including prioritizing education, gaining trust, and distribution related to COVID-19 vaccine, increase affordable healthcare and testing, as well as social support and resources. We still have a lot of work to do locally and nationally. And as Circle, we are committed to serve. We would like to thank you, Circle leadership, staff, and volunteers. This work would not be possible without their dedication, commitment, and service. We would also like to acknowledge our funders and partners who are listed on the screen here in the poster for their generous support and partnership. So thank you for listening.